so we will turn to English, but given the level and nature of the audience, I'm sure everyone understands what I will try to say. I'll be very simple. I, of course, would like to commend the Honorable Minister of Health for the great work he's been doing during his tenure and for the trust is given to WHO. We have an excellent collaboration with the Ministry of Health in Greece, and it's really a pleasure to be, in a way, breaking new ground with our joint initiatives. And some of the things that the Minister was discussing, notably this groundbreaking information system for the first time in Greece that will see the light early in the next year. We believe it's going to make really a significant change. It's something that's never been done before, not just in Greece, but maybe in many other countries in Europe. And I think that this innovation spirit is really deserves to be commended. So, of course, I mean, when we discuss vaccines and the potential of immunization like we are doing here today, I don't need to remind you about where WHO is sitting in this context. We know about the life-saving. We know about the most significant and relevant prevention and public health tool we have at our hands. We are very concerned, of course, with the misinformation and the negative and less positive use of these arguments that undermine public health. But I guess that's life, and we need to take it moving forward based on science and what the evidence tells us. That's the most important. This is not a short run. I believe this is a marathon. And trust me, we are here as WHO, we are here for the marathon run. We're very resilient. We're going through also a very big crisis globally, as you know, financial and other elements, but we're still standing and moving forward, defending public health. And as part of public health immunization, vaccines are also, of course, life-saving. And we also need to practice what we preach. I have to tell you that I just got my flu vaccine last week, and I got my COVID boost also here in Greece in a very easy, nice way. Congratulations for that. You've done a great job there, better than in other places, I have to say. So my Greek friends always, you have a tendency to complain. I already know you after these 5 years, but you'll do a lot of good stuff in a good way. And I say this not to commend the minister or the Ministry of Health. It's all of you. There's a lot of good things, really, that you have, even in the context of the health system in Greece, that we all need to, I would say, learn also to value, because that's very important, and you don't find it anywhere. We work with 53 countries in the WHO European region. And Greece stands out as a great collaborator of WHO. Greece is one of the countries that works more with WHO and that puts resources where the mouth is. Like, it's not just talk about collaboration, but here in Greece, we're working together, but also with the support of your country, helping other countries that are in a worse situation. And there are many, many countries which are much worse than Greece, because we have all the 27 of the EU, plus all the others, including Eastern European countries, some of them going through war and conflict and all of that, as you know. I don't need to remind you of that. So for us, it's vaccines, immunization, it's at the core of everything we do. And of course, we commend Greece for having the initiatives and the programs that you have. It's always important to improve, but also important to acknowledge the successes. Today, I'm also asked to sort of make the link between One Health and the issue of vaccines and immunization, and there is really, I think there's a strong connection there, particularly with AMI, antimicrobial resistance, which is a serious challenge also in your country. Some people argue it's already a permanent crisis. It's not something that's coming for the future, and we tend to agree with that. We know that millions of lives have already or are at risk of infections. that no longer respond to available medicines. It is common sense. I'm not saying anything is new for you. Therefore, we really need to address these issues of AMR that undermine the foundation of our modern health care and medicine, and puts at risk simple things or complex things, if you want, like surgeries, cancer care, childbirth, chronic diseases management. This is serious. But we've seen that in this case, we need more collaboration. Countries cannot resolve these issues alone. We need to collaborate across regions, across countries. And it's one of the lessons that no one can address AMR alone. It's a bit, of course, like infectious diseases and as pandemics. It's a shared global change. No one can do it alone. Therefore, we need, and what WHO and the UN agencies propose is a joint approach, a One Health approach that links environment with animal health and also human health. It's very easy to say, it can be very demagogical, I would say, because it's very difficult to implement, because it requires that sectors that traditionally wouldn't work together so well that they need to come and sit at the same table. So it's about recognizing these links between human, animal, and environmental health. We also acknowledge that a large share of emerging infectious diseases that affect humans, they are originated in the animal world, and we see less and less divide between nature and humans, and this is a challenge that we also need to address. And therefore, as I said, the UN is trying to make sense out of this and really putting in place mechanisms, platforms where different organizations come together. One of them is really this platform when it's called the Quadripartite Alliance, where WHO, FAO, but also the Agency for Animal Health and also UNEP, which takes care of environment at the UN level, come together and try to promote a One Health approach to increase our resilience. So it's about coordination, multi-sectoral action, and all of that. We believe that AMR drivers are really system-related. One of them, part of it is antibiotic misuse, of course, but there are also issues with data and issues with poor capacity of our systems, not just health systems, but social systems and others as overall. We also have lack of surveillance mechanisms that particularly look at these interactions and these connections between environment, human, and health. And that's really a problem. This lack of integration is complicated. We also know, needless to say, many of you are the majority health professionals, that antibiotics are often used unnecessarily. All my Greek friends have at least 4 packages of antibiotics before going on vacation. This is something that I've learned since I'm here, but things are improving because I tried to buy an antibiotic for my dog last year in Kifisia and I couldn't make it. So I had to go back and get the prescription. So progress is being made. But you know, Greece is one of the countries where antibiotics are, it's one of the countries that has a bit of a problem here. And we have to do more about that. It's not just about health professionals. It's also about the public because people put pressure and demand it. And we know how difficult sometimes this is. So infection prevention and control programs also at the level of facility, nosocomial infections is a problem. It's a problem in many countries, still an issue in Greece, and we need to look at that. And of course, more coordination and governance, training, these things need to be improved. Now, where does all these links with vaccine? So we know vaccination prevents infections. Each infection avoided means less antibiotic use because many times we also use them when they are not needed. And we, of course, lower resistant risk. Human vaccines also reduce antibiotic consumption and resistant rates globally. Animal vaccines are also important, and that is an area that also needs more coordination and integration. Vaccination strengthens pandemic preparedness and reduces zoonotic spillover. This is an important one. Maybe I didn't need my COVID vaccine, but if I have people I interact with, which are older, they have comorbidities, I need to have that responsibility towards not just my parents and their friends, but as a society. This is something we should not forget, and it's very important. So all these vaccination programs and immunization calendars and all of that, perhaps some people argue that we also need to look into, also do it in a more integrated way, also looking at the animal and the environmental aspects. I really think that Greece has shown some leadership, and there are some opportunities for improvement. You've taken important steps: National AMR Action Plan, infection control initiatives, and digital health initiatives on this area. More obviously needs to be done. We work on quality of care and patient safety. So our office in Greece is the only WHO region where there is an office focused on quality of care and patient safety. And of course, all of this has to do a lot with quality and even more with patient safety. And having this opportunity here in Greece, where we work together with many of your hospitals and also your health centers, I think is an area where Greece can really show leadership, and we have to do more out of that. All countries struggle to have this One Health approach institutionalized at the national level. So it's not just for Greece. Traditionally, agriculture and health never work together. They are huge ministries, normally with difficulties in coordinating and working together. So it's an effort that everyone really needs to do, and bringing all these partners is very important. But we can put our own house in order, right? Myself, as a health professional, and all of you, we need to get our health institutions to do better here. And there's really a long way to go and a lot of work that can be done. Much more can be done. If we put our own house in order, when we talk with others, we speak from a place where we are in a position of having the right to demand more action. But that requires that we also see progress. And in many European countries, particularly in southern European countries, there's more work to be done. Also in terms of training, antimicrobial stewardship in hospitals, in primary care, and really training in terms of prescribing, educating future health professionals. This is very important. We also need to do more and better surveillance, better data. With the forthcoming platform, we are looking into indicators that touch upon these areas, so you will have data more integrated. So we're taking data from all the Greek institutions that somehow deal with this data. You name it: Ketechni, IDICA, ODP, AOD, whatever. I sometimes forget the acronyms because of my poor Greek. But that's it. It's really, you're leading the way here. And I can assure you that, because we deal with this every day. And also integrating, of course, everybody talks about AI. It's important. Gives us some extra opportunities. But also it's about the public. This is about health literacy. If you have a patient or a family person, you are a doctor, asks you for an antibiotic when it's not needed, there is something wrong. We need to work more on cultural and behavioral interventions that people understand, that are more educated, they understand better how to navigate the system. And really, health literacy, it's something that we also need to work more, and it's really required. So the understanding of the public is vital. We need to get the buy-in of the population for, of course, vaccines and immunization. Greece is not doing bad here. It's not the best country, but it's also not the worst. There are countries with better coverage, and we can benchmark. We can learn from them. I'm from a country where we are very proud of our immunization program. But it goes back 50 years. After the revolution, people learned to trust, particularly primary care doctors, the nurse. You wouldn't be able to go to school without the vaccine. All this stuff takes time. But easily you can lose that trust. So we also cannot be arrogant. We need to understand those who don't trust so much, those who are suspicious. We need to work with them. We need to work with them. It's not about just thinking that we're losing them out. Forget it. They are ignorant. No, when people have doubts and when people go on social media and they complain about immunization vaccines, they don't believe and they buy into this fake news because, I mean, most of us, we are scientists. We know where the data is and the data speaks for itself. But it's strange that people don't believe in it and they challenge it. There is a reason behind it, and we need to work with these people. We need to be respectful of those who disagree, even if it's a completely crazy idea. So fighting this misinformation is one of the critical issues that we need to do more together. So my last point is really on building trust and awareness and more communication. The policies, the legislation, all of that is very important, right? But you have a legislation that you need to drive your motorbike with a helmet every single day, wherever you go. But you still see people in the streets driving without a helmet. Much less than 4 years ago, I can tell you. This is my empirical evaluation, but that's the case. So it's not just enough to have great regulation. You have a fantastic, really good legislation on smoking and tobacco products. But if you go to Kolonaki on a weekend, you see kids vaping inside. Maybe your children or grandchildren. Sometimes it's about the issue of communication, education is very, very important. And I think in immunization, that's one which is really critical. But we have to be respectful and try really to work with everyone, even those that we really think this is crazy, this is non-science, this has nothing to do with evidence, but probably those are the people we need to work more with. Thank you very much, and I wish you good luck. Thank you.